Good morning, sir. I'm Princess Almudal. For today's video, we'll be doing the range of motion procedure. This kind of exercise that are performed by client, himself or herself by a nurse in case of helpless client, mobilize all joints through their range of motion. Are those which is joints move through its full of range of motions according to the capacity. There are two types of range of motion. Number one is the active. Active done by the client, him or herself, while the passive doing with the help of the assistant from another person or the what we call the healthcare provider. The purpose of this exercise, it aims to increase the muscle strength and endurance, to maintain normal physiological function, to prevent the complication caused by immobility like contractures, to improve the patient participation in activities of daily living, and lastly, to improve the physical activities. Now we're going to close the curtain and the door to ensure the client's privacy. Now we're going to perform the proper hand hygiene by washing our hands with clean water and soap. Proper hand hygiene controls the spread of microorganisms or the infection. Then we're going to rinse with clean water. Now we're going to wear our gloves to control the spread of the microorganism before we're going to proceed with the procedure. Hi ma'am, I'm Princess Almudal. May I know your name ma'am? I'm Ellie. Today we'll be doing the range of motion exercise so that your body will mobilize again. It will strengthen your joints and muscles. And then we'll be doing the exercise all together. So I'll be giving you the instruction. First, you will do it by yourself right after, okay? So I'll be putting the client into supine position. So you have to do it and then you're going to move your body. Now I'm going to put the client into supine position. Okay, ma'am, I'm going to put you in supine position. And then you're going to range of motion exercises will start from head down to the foot, and every part should not expose. We have to cover those parts that are not being used. So this is to provide the privacy, and also we do hand washing and we'll use the gloves to control the spread of the microorganism. So we'll be starting from the neck. So this is the intra-procedural step. So next is we'll do the flexion and then the extension. Next is the hyperextension, then the rotation, and lastly the lateral flexion. Now we will start by the flexion. So this is the flexion, the extension, the hyperextension, the rotation, and lastly the lateral flexion. Can you do it, ma'am? So the flexion, extension, the hyperextension, the rotation, and lastly, the lateral flexion. Thank you, ma'am. So for the shoulder, ma'am, this is the flexion. The hyperextension to be extended to the back. And then the abduction. And then we have the inward rotation. And then lastly, the outward rotation. And then, can you do it alone, ma'am? From flexion, from a hyperextension, abduction, the inward rotation, and lastly, the outward rotation. Thank you. And then for the elbow, this is the extension. So this is the extension, ma'am. together, if the client can do it together, it's better. So, this is the extension. If not, you can do it one by one. So, this is the extension, the flexion, and then lastly, the hyperextension. Like you pull your body out. Can you do it, ma'am? The extension, the flexion, and then lastly, the hyperextension. So, ma'am, for the hand, this is the flexion. And this is the hyperextension. And then, can you do it alone, ma'am? The flexion, the hyperextension. Can you do it with your own, ma'am? We have the supination, the neutral, and then the pronation. Okay. Thank you. Same with the other side. So since our client not available to the hip, I'll be doing the trunk and the hip. So for the trunk, this is the flexion and I'm gonna put this way, and then the hyperextension for the hips rotation. So this is the flexion, and then the extension, and then the lateral. Same to the other side. For the knee, you're going to put the client in comfortable position, cover the half leg, then over half we belong to the knees. Okay, now, first we're going to put the client in comfortable position. Okay, ma'am. And then we're going to cover the half knee. And then we're going to cover the other half of the legs. So this is the flexion. And then this is the hyperextension. Okay, can you do it, ma'am? So the flexion. And then the hyperextension. Thank you. And then, ma'am, for the toes, we have the flexion, and then we have the extension, flexion, then the extension, and then we're going to cover the legs of the client, and then you're going to do it with the other side. The procedure again, we will do the range of motion exercise from head, neck, down to the shoulder, the trunks, the hips, and legs, and lastly, and the toes. For procedural step, wash our hands, make our client comfortable, then record the procedure. Are you feeling okay, ma'am? Okay, your muscle and joints relax now. We will do it every day. It depends on the advice of the physician or the doctor.